Oxytocin, also known as the love hormone, narrated by Abishai Elizondo, year 2020. So what is oxytocin? Oxytocin is known as a cyclic nonapeptide hormone that is released by the posterior lobe of the pituitary gland, which is a small pea-sized structure located at the base of the brain. In women, the hormone's primary action is to cause contractions of the uterus during labor and help shrink the uterus back to normal following childbirth. It's also known that when a baby suckles at its mother's breast, the stimulation triggers the release of oxytocin, causing the subsequent release of milk. While both of these are physiological implications of oxytocin, there have also been found psychological implications of oxytocin as well, as it also acts as a neurotransmitter when released into the brain. For example, oxytocin is very commonly referred to as the love hormone or the cuddle hormone, the moniker stemming from oxytocin's role in helping to facilitate and reinforce strong bonding between two individuals, often viewed in the lens of two lovers or a mother-child or father-child relationship. It is said to provoke feelings of contentment, calmness, and security. It is common for oxytocin to be released from something as simple as hugging or cuddling with a significant other. Release of oxytocin has also been seen in parents as a result of playing with or spending time with their young child. In essence, oxytocin aids in strengthening social connections by tying external social interactions to the internal brain's reward system, facilitating aspects of bonding such as trust and attachment. Now, where is oxytocin found? It is produced naturally in the posterior portion of the pituitary gland. It can also be artificially synthesized, yet it is just as effective as its natural counterpart. Also in women, oxytocin release is at an all-time high during pregnancy and childbirth. Discovery and classification. Oxytocin was first discovered in 1909 by Sir Henry H. Dale when he found that an extract from the posterior part of the human pituitary gland in the brain resulted in the contraction of a pregnant cat's uterus, as oxytocin is found in exactly the same form in every mammalian species. Now, as early as 1911, physicians already began using it to stimulate childbirth contractions. It has since been classified as a nonapeptide hormone, which is a peptide formed from 9 amino acids. It's been classified as a pituitary hormone produced in the posterior portion of the pituitary gland, and it's also been classified as a drug for its therapeutic purposes. Physical characteristics of oxytocin. Oxytocin has a molecular formula of C43, H66, N12, O12, S2, with a molecular weight of 1007.2 grams per mole, a melting point of about 192 to 194 degrees Celsius, a boiling point of 1533.3 degrees Celsius. It's also been found that oxytocin is soluble in water as well as in butanol, with a solubility in water of about 1.2 times 10 to the fourth milligrams per liter at about 25 degrees Celsius. And of course, there is an image of the molecular structure of oxytocin. Does oxytocin have any enantiomers or molecules similar to it? The answer to this question would be no, it does not contain any enantiomers, although it is very similar to vasopressin, which is also a nonapeptide. And the combined effects of oxytocin and vasopressin are believed to influence social cognition and behavior. Finally, getting to the benefits and the drawbacks of the use of oxytocin. Some of its benefits are that it induces uterus contractions in women, stimulates lactation in women. It also facilitates social bonding. It plays a role in increasing sexual arousal. It's also been found to reduce fear and anxiety. And there are also ongoing studies that are observing prescribed oxytocin doses to autistic children in order to facilitate positive behavioral responses. And it's also been found to reduce withdrawal symptoms in drug addicts, meaning that it could be useful in inhibiting addiction. Some of its drawbacks, however, is that it's been found to also, in spite of facilitating social bonding, it can also have the opposite effect, which is to strengthen negative bonding experiences. Also, when administered, another one of its drawbacks is that it may cause trouble urinating. It may also cause severe stomach pain, weakness in the body, irregular heartbeat, and signs of high blood pressure.